Hello, Suzanne Kellner-Zinck with Dawning Visions Hypnosis, here to say something that truly needs to be understood by those who, shall we say, practice mental health in the conventional sense. You know, there's something very sick about having to pathologicalize every single normal human emotion, to give it a diagnosis. And of course, with a diagnosis comes a medication. And when that medication doesn't work, another one is added on top, ad infinitum. And then we wonder why we have so many problems in our society, especially in the United States, where this kind of legal drug pushing is normalized. You know, many years ago, when I was being treated for manic depression, that's what it was known as in those days, that's how long ago it was, my ex-psychiatrist of 13 years, so she knew me very well, let me know, as I was stabilized chemically on lithium during that time, that everybody who's a human being has a normal, shall we say, span of emotions that are experienced. And just because somebody is angry or sad doesn't make them pathologically ill. You see, we have to make a discernment here, folks, of what it is we're dealing with. I have a story to tell you from one of my professors in my doctoral program. God bless her for sharing this with me. And she told me the story of going to see a therapist and telling the therapist that she did not want to have a diagnosis attached to the fact that she was grieving the loss of her kid, because it was a normal human emotion. She shared this with me because in my discussion post, I had noted this particular problem in the area of mental health provision. She was agreeing with me and sharing with me a very private detail of her life, which I truly appreciate. After all, she's a professor in a doctoral program on psychology. Very interesting indeed. We need to understand that most of the problems that we have with regulating human emotions is A, parents did not do their job in teaching their children this thing called no, you cannot have it now, you need to wait. It is okay for you to be upset, and you'll do it in your own room. You can be angry, but you're not allowed to abuse me. Go in your room, and when you're ready to have a respectful conversation about what happened, we can do it then. Until then, we're not talking. I also see that we have major issues with the shit food on the market, especially in the United States, and any country that's emulating this sick way of preparing food with preservatives, additives, ingredients seen as not dangerous, usually natural flavorings, whatever the hell that means. And then you wonder why your kids are going bonkers, especially the kids that are on the spectrum, whose biological systems can't handle that crap. It's a known fact. They're missing some of the bacteria and things that they need in their gut to process that crap. And that's why they get angry or irritable or hyper around this crap. And parents need to help their children to choose better. That is your job as a parent. It is not your job to succumb to everything your kid wants. Because I'll tell you this, at least as far as my family is concerned, one of my sisters had a problem with the fact that she was allowed to do anything she wanted to do. Well, she wasn't really allowed to do anything that she wanted to do. She just never listened to my parents and did it anyway, and ended up screwing up her life in the process. And then she blames the parents. At some point in life, we have to take responsibility for ourselves and who we are and what we're doing in this world. And if we're parents, what are we doing as parents? You are not your child's friend until they are adults and out on their own. That is when they earn the ability to be more like a friend than like a child. Although to you, they will always remain your child because that's who they are in your family. Until then, it is your job to regulate them, to give them guideposts, values. What is the correct way to be out in the world and not? And giving them the freedom that is appropriate for their age. And understand that teenagers are not adults. Their prefrontal cortex is not fully developed. That's why they do impulsive, stupid things. They don't think about the ramifications of their behavior because they're not there yet. That's why you are a parent and they are your child. And if you don't know how to deal with them, I highly suggest you get some help and learning how to create appropriate, healthy boundaries. God knows I do that a lot for my clients. And they welcome it. So, as you're doing your work with your patients and your clients, ask yourself this very serious question. If I was dealing with the same thing my client or patient is dealing with, would that merit a pathological diagnosis and perhaps the medications that one might prescribe for it? Second question is this even an emotional problem? Because often it's physiological. Anyone heard of menopause? Premenstrual syndrome? Thyroid problems? Adrenal gland problems? How about side effects from the very medication that they're stuck taking because some stupid psychiatrist is unwilling to help them get off it and instead prescribe something else that just compounds the problems? Or how about genetic mutations? That was a problem one of my clients had, and it took forever for us to figure it out. Integrative doctor that I had referred her to worked really hard with her over a few years till he found out the problem and was able to give her the supplement she needed to make the serotonin, dopamine, and GABA her body was not able to make for herself. There are so many things that can affect how people look and feel emotionally. And we need to understand those differentiations, which is why I think everybody who gets into any kind of healthcare needs to learn the mental health aspect of it, the medical aspect of it, the nutritional aspect of it, the genetics. Because sometimes clients, when they're very young, take on dysfunctional behaviors from the people that they are raised by. Has nothing to do with them. In the case of doing hypnosis with these folks, it's pretty simple. All I have to do is let them know they're not that person, and we just cut the energetic cord between them and the other person and have them realize they can make their own choices and not act out like the person who they were automatically emulating, who is not who they are, nor necessarily who they want to be, because it is dysfunctional behavior after all. So these are my thoughts that I want to share with you today, because I think it's important that we start looking at people who come into our practices looking for us to be able to help them, to actually help them and stop the pathological bullshit that the mental health system is built on, because as you all know, based on the lack of results your patients are getting, because they're not healing completely and totally like mine do, you're managing symptoms that perhaps you need to look a little deeper into yourself and why you are doing what you are doing. And question why you're doing what you're doing, and if it's working or not for your client or your patient. Because that's what you're being paid to do, help them heal and move on in life, not manage symptoms and keep them medicated so they can't think clearly and they have their emotions dulled forever. Most patients complain endlessly about this problem with the medications. And by the way, most of these medications are not tested empirically for any period of time that matters at all. Lithium works for mood disorders, but you have to worry about the problems to the thyroid and the kidneys slowing down, and detoxification. Antipsychotic drugs work in some cases, but probably a hell of a lot fewer than we actually will acknowledge in reality. And the rest of it, as far as I'm concerned, is a bunch of crap that destroys people's immune function, ability to function, and the rest of it. 97% of the folks who are on that crap don't need that crap. If they were to see a hypnotist who actually knew how to help them heal without any of it, they'd be fine. And they'd be fine a hell of a lot quicker than years and decades of therapy going over the same sad stories using a prefrontal cortex. It doesn't help anybody. Sigmund Freud is the reason why you do that crap. I'd rather look at Dave Ellman, who was able to clear people of pretty much any problems they had in a matter of minutes to a few hours. And he wasn't even a clinical hypnotist. He was a stage hypnotist that the doctors and dentists asked him to help them heal their most difficult patients during I think it was the 40s and 50s. That's right. So what you can do if you actually learn how to use the subconscious mind of your patient to help them heal and move on in life. Because if it were you, my guess is that that's exactly what you would want if you are in their shoes. In fact, most of you are in their shoes, and it's time to get out of them and do something better for yourself. Anyway, Suzanne Kellner-Zinck from Dawning Visions Hypnosis. I thank you for taking time to listen to this important message, a reality check that most people don't have the guts to share with you. They just hide quietly, doing the same old shit that doesn't work for anybody, including themselves. As always, I thank you for taking your time. Until next time, bye-bye.